You ever wonder why it's so hard to set up an A-line? Maybe you haven't done it for years. Maybe you were never shown. Well, today's your day. I'm the Nurse G, and I'm bringing you an RRT. Hey everyone, I am the Nurse G, and I am bringing you the RRT, which is A-line setup. Now, just remember, A-line setup is a really simple process. If you know how to spike a bag of saline and give a patient a bolus, you essentially know how to set up an A-line. When that doctor's got his hand on the groin and calling for that A-line, hand it to me and you feel rushed, just stop. Push everything out of your mind. And just remember, A-line has 5 letters, A-L-I-N-E. You need 5 things to set up this A-line. First, you need a pressure bag. Second, you need a 1-liter saline bag. Third, you need A-line tubing or pressure tubing with a transducer. 4, you need an A-line cable. And 5, you need a positive attitude. Alright, so now we're ready to set up the A-line. We've got all our 5 things that we need, including our positive attitude. Alright, so go ahead and grab your pressure bag, open that bad boy up. Once you have it open, you can either leave it to the side or hang it on your pole, but you're going to have to get it down in just a minute. Then, take your normal saline. Liter bag is best, 500 will work. This is the trickiest part of setting up the A-line, is getting this liter bag inside this pressure bag. If you do it just like that, you usually have no problems. There's a little hook in there that hooks right onto it. Pull it down, pull your tab down, and you are good. Hang that up, and you are now almost ready to have your A-line inserted. Go ahead, take your A-line tubing. Open that bad boy up. Now, this is where it gets really tricky. Don't just open that package up, rip out your A-line stuff, throw everything everywhere. This is very important. This, right here, is a non-vented cap. These A-line tubings come with vented caps that have a hole in them that make it able to zero it when it's hooked up to the patient for the first time. Go ahead and uncoil your A-line tubing. Stretch it out. You want to check all your connections here. Make sure that they're on tight. Sometimes these come loose from the manufacturer, and if you put it under pressure, sometimes it'll pop off. There's a few things about the A-line you need to know. This is the transducer, and this is a pigtail. Again, this is the transducer, this is a pigtail, this is your vented cap. This cap has a little hole in it. That's the cap you want to remove and replace with your non-vented cap that you saved and did not lose. Also, this is known as a vamp. Don't ask me why, but that's what it's called. It's called a vamp. With this vamp, all you have to do is push it straight down because it comes from the manufacturer up. If you try to prime this line with that vamp up, you'll get a lot of air swirling around in there, and you won't get the bubbles out, and it'll take you forever to do. And that doc that's got his hand on the groin looking for that A-line, he's going to say, why are all these bubbles in there? And you're going to have a hard time. So push that vamp down, and now you're ready to go. Avoid clamping anything else, and get ready to spike your bag. Spiking your bag is just like any normal saline bolus. Go ahead and pull the spike, pull your blue tab off your saline, and go ahead and insert it into the saline bag. Now, fill up your drip chamber. And this is what takes the longest. Turn your little dial here to off to air, and you must pump this up. You have to continue to pump this up until it gets to 300 millimeters of mercury, or until the green shows on the pressure bag. Once the bag's fully inflated, move the stopcock up in order to prevent air from leaking out. You see green? Green is good, you're good to go. Now, because you didn't close anything else off, you are ready to prime this line. In order to prime the line, all you have to do is pull this pigtail straight up, and this will shoot water out. Boom. Now you're ready. You can hand this to a doctor, and they can put it right onto the A-line that they just inserted, and you are good to go, no more mess, and essentially your A-line is almost done. Now you're ready to zero your A-line. Take your A-line cord, plug it into the back of the machine. If it doesn't bring it up automatically, you'll have to press one button to activate it. Place your transducer cable to the cable to your monitor. If it does not pop up right away, you press the 3 X's in the bottom right corner. Press wherever you're plugged in and press activate. Once it pops up on the monitor, you're ready to zero. When zeroing your A-line, place the transducer at the phlebistatic axis. This part goes to the patient. So take your switch here, turn it off to the patient, open it to air, zero art line. Once the zero button is pressed on the monitor, you'll see a date and time flash that should be recorded in the MAR. You should zero your A-line at the initial insertion, anytime there's a position change of your patient, and at the beginning of every shift. Once the zero is complete, replace the cap onto the open port and move the stopcock to the up position to open the system to the transducer. If all steps have been done correctly, you will start to see a cardiac tracing and a blood pressure for the arterial system will be displayed. Hey everyone, thanks for watching. Hope you enjoyed the video. Check back here for more videos on everything emergency medicine. Leave a comment in the comment section on what skills or topics you'd like to see from us. And remember, keep your skills sharp, your vital signs stable, and I'll see you at the next RRT.